This is the Invite Health Podcast, and I am Amanda Williams. On today's episode, I am going to be introducing you to Greenlip mussel. What in the world is Greenlip mussel? Well, we are going to talk all about that today. We are also going to delve into a really cool herb known as Perilla and what happens when you combine Greenlip mussel with Perilla, how beneficial that can be for your respiratory health. So we are talking lung function today. But before we get started, I just want to give you a reminder to subscribe to the Invite Health Podcast. You can leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So what in the world is Greenlip mussel? And why would anybody want to take this as a supplement? Well, I'm going to break it down for you. We've all heard of fish oil. People have heard of krill oil. People have heard of the plant-based omega-3 fatty acid, things like flaxseed and chia. Those are really good sources for the plant-based omega-3s. But Greenlip mussel, this is the shellfish that's native to New Zealand. This is very rich in omega-3 fatty acids. In particular, they're a really rare source of a type of an omega-3 that many people have not heard of. Most people have heard of fish oil and krill oil, which contains EPA and DHA. And then people have heard of flax, and the flax contains ALA. Well, the Greenlip mussel from New Zealand contains something known as ETA. And the ETA is this very powerful omega-3 fatty acid that is super important when it comes to the way our genes are working relative to the production of what is known as cyclooxygenase. So when we're thinking about the inflammatory pathways in the body, we know that ETA can actually reduce the formation of arachidonic acid. And we know if we have excess arachidonic acid, we are going to end up with more inflammation in the body. So the Greenlip mussel, excellent source of this really rare form of omega-3 fatty acid. So ETA, remember that. Now, when you combine this with this powerful herb known as Perilla, you end up with a formulation that we have, which is called Inflamune. And the Inflamune formulation is a really nice formula to have on hand during this time. When we think about this current pandemic, we think about what we can be doing to ease inflammation in the body to help to support a healthy immune system response. When we combine that ETA along with that Perilla extract, we are really doing so much benefit at that cellular level when it comes to the inflammatory response and to the immune system. So let's talk a bit more in detail about the Greenlip mussel and how this has been looked at. Initially, a lot of the focus on Greenlip mussel was in the setting of osteoarthritis and for people who had significant joint degeneration and joint pain. So they were looking at different complementary treatments as opposed to just people taking NSAIDs and a lot of the prescribed medications that are available for arthritis. And they were looking at if something such as the Greenlip mussel would be beneficial when it came to targeting that inflammatory process that occurs in arthritis. And they were, much to their chagrin, they were very happy to see that Greenlip mussel was indeed a very powerful way to go around doing the conventional treatment. And this would be a really lovely adjuvant treatment. And it was clinically relevant in terms of the time in which people were reporting back the clinical benefits of green-lipped mussel. So a lot of research done in the setting of arthritis. So that we already knew. But then we started to look at it in the setting of respiratory health. And the European Respiratory Journal back in 2002 was looking at the treatment of asthma with Greenlip mussel from New Zealand. This was a randomized clinical trial. They said asthma is this chronic inflammatory disease of the airways, and it is in part mediated by leukotrienes. They wanted to see if the New Zealand Greenlip mussel would be effective in inhibiting 5-lipoxygenase and the cyclooxygenase pathways. So we have 3 different pathways we're dealing with: the COX-1, COX-2, and then the LOX pathway. So the lipoxygenase, and then we have our cyclooxygenase pathways. The reason why that's important is because when we think about NSAIDs, the non-steroidal anti-inflammatory drugs, that's where those drugs are targeting, is those pathways. But we also know that those medications can come with a whole slew of potential side effects for certain folks who are taking. And we definitely want to always try to mitigate that type of a risk. So looking at this study that came out of the European Respiratory Journal, they recognized that the lipid extract coming from that New Zealand Greenlip mussel may have some beneficial effect in patients who have asthma. So looking at the way that the body was actually utilizing that Greenlip mussel, and it was down-regulating a lot of those main inflammatory cytokines and prostaglandins and leukotrienes that were being released, driving up that restriction in the airways, making it more difficult to breathe, occurring things like coughing, wheezing. So right now we're thinking to ourselves, okay, well, what can we be doing to support healthy respiratory tract? Well, this is why the Greenlip mussel in combination with that Perilla may be a very good option. So let's take a quick break. When we get back, I'm going to tell you a bit more about some of the science on these two nutrients. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
And welcome back. Let's talk a little bit more about green-lipped mussel. So we know that the green-lipped mussel, this is coming from New Zealand. We know that it's got this really rare, powerful form of omega-3 fatty acid. We know from clinical research that this can target the lipooxygenase and cyclooxygenase pathways, which therefore limits the amount of inflammation, which is why so much research has gone into a lot of the chronic inflammatory conditions, such as arthritis. But they have also looked at the greenlip mussel in the setting of chronic airway inflammation, things like bronchitis and asthma. Now I want to talk a little bit about the Perilla extract, because Perilla is quite interesting. The Perilla extract itself has been utilized for many different medicinal purposes throughout its time. The Perilla leaf itself is very powerful when it comes to the amount of antioxidants and other powerful constituents in it. It actually contains rosmarinic acid. So rosemary extract is a natural component of the Perilla. And one thing that we know about rosemary extract is that that is a major player when it comes to targeting histamine release. So if we are exposed to a particular pollen, for example, so we'll think seasonal allergies. If someone has a allergic reaction to a pollen. And this isn't like a severe allergic reaction. We're talking about, you go outside, pollen's in the air, and next thing you know, you have runny eyes, you have a runny nose, maybe a scratchy throat. We know that this is all driven because of histamine. Well, we know that rosmarinic acid is very beneficial when it comes to targeting that histamine release. So it tampers down the amount of histamine that is released. So one would think that if Perilla leaf extract contains rosmarinic acid, then it too would be beneficial. So in a study that was published in the Evidence-Based Complementary and Alternative Medicine Journal back in 2015, they were looking specifically at the Perilla extract and how that suppresses the allergen-specific T helper 2 response and alleviates airway inflammation and hyperreactivity in asthma. So once again, we're talking about respiratory health here. We're talking about how inflammation within the respiratory path, that respiratory bronchi, all of those areas where we get significant amount of inflammation that can occur, we want to be able to target that. And for many people, there's a lot of different prescription medications that are out there, but maybe they don't do so well on those. So oftentimes they are looking for different alternatives. So this particular study, this is what they were looking at to see, would the Perilla extract do anything in terms of the airway constriction, in terms of targeting the histamine? And indeed, they were impressed that the Perilla extract really did make a significant difference when it came to the way that the immune system was responding and being able to regulate better control of inflammation. So this is all a positive thing. Then we added in with an omega-3 fatty acid, which we already know that omega-3s are very beneficial at helping to regulate inflammation in the body. So we have two different things, the Greenlip mussel combined with that Perilla extract, that really give you kind of this 1-2 punch when it comes to supporting a healthy inflammatory response, which right now is incredibly important. We want to make sure that our lungs are really functioning where we want them to be. And for people who have pre-existing conditions, these may be concerns that you have. You may have a history of asthma. You may have a history of COPD, which is chronic obstructive pulmonary disease. If you fall into one of those categories, then right now during this pandemic, you probably are at this heightened state of alert because you do have that concern, already knowing that the respiratory tract itself is compromised. So this is why when we look at something such as the Perilla extract combined with that Greenlip mussel can be very beneficial. So let's take a quick break. When I get back, I want to tell you about another interesting study looking at the benefits of Perilla extract. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
So welcome back. Let's talk a little bit more about the Perilla extract. Let's talk about that study where they were looking at the implications of giving Perilla extract in the setting of allergy-induced asthma. And what they found was a significant decrease in things like tumor necrosis factor alpha and a lot of the other markers that you would look at when you are assessing for excessive inflammation that is occurring in the body. In particular, we're focusing on the lungs and respiratory pathway. So they concluded that the Perilla extract, the Perilla leaf extract, was a potential herbal medicine for immunomodulation. So what does that mean? It means it's not just targeting inflammation. We're talking about the immune system response. We're talking about this through T-cell immunity. So we can kind of take a step back and say, wow, isn't it remarkable that things from nature once again are yielding these very powerful effects in the human body? So we talked about the Greenlip mussel and how that's targeting the COX-1 and the COX-2 pathways. But I want to tell you about one more study. And this particular study was in the Italian Journal of Pediatrics, where they were looking at the impact of Perilla extract in combination with quercetin, which is a powerful bioflavonoid, and vitamin D, and giving that combination of Perilla extract, quercetin, and vitamin D to a pediatric population who had allergic rhinoconjunctivitis. So in this, we're taking children who basically have this allergic rhinitis exacerbation. We're talking about allergic rhinitis. We're talking kind of just the common cold that can affect the sinuses as well as the airways. And they found that these children responded really well to that combination of vitamin D. Remember, that's required for both the innate and the adaptive immune system. The quercetin, this powerful bioflavonoid, this powerful antioxidant, which we know has been studied in the setting of coronaviruses, along with Perilla extract. And they found that when they gave this to these children, that this served as a preventive treatment in the allergic rhinitis for these kids. I mean, just some really remarkable research out there. And for me, when I look through the clinical studies and I look through the different research, I always am amazed by how often things like this get overlooked. We're taking something from New Zealand, this powerful Omega-3, the Greenlip mussel, and understanding the enormous amount of support that that can give to a proper immune response and an inflammatory response. And then we're taking this Perilla leaf extract that has been widely studied and shown to be, once again, very beneficial as this immunomodulator. And then when we combine them together, then you have to take a step back and say, wow, yeah, that Inflamune formulation really is very beneficial. And I have people who use it for a lot of different reasons. I have some people who find that if they do have joint discomfort, that when they use Inflamune, they seem to feel much better. I have people who consistently use this every time they feel like they're coming down with a common cold. They take this for the purpose of keeping those airways open and helping to support a healthy inflammatory and an immune system response. So a lot of different utilizations for this particular formulation. So it's called Inflamune. You can check it out on our website, and I certainly encourage you to do so. Now, that is all that I have for you today. Kind of went over a lot of details when it comes to the Greenlip mussel along with that Perilla extract. And I just want to thank you for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Make sure that you subscribe, you leave us a review, follow us on Facebook, Twitter, and Instagram at Invite Health. We will see you next time for another episode of the Invite Health podcast.